You ever wonder why you keep turning your ankle, twisting it on a pebble or something or nothing? You may have ankle instability. Let's learn about it.
Welcome to Talking with Docs. I'm Dr. Brad Wayne.
I'm Dr. Paul Zalza, and we have an ankle specialist with us here, Dr. Ajay Manju.
Hey guys, how's it going?
Good. Thanks for coming.
So good.
Okay.
Tell us about ankle instability.
So ankle instability, it's fairly common,
Okay.
and it all has to do with the lateral ligament complex of the ankle.
Okay, so
right?
the outside of the
the
ankle.
outside of the ankle.
And the ligaments are those soft tissues that hold the bones together in a joint.
That's right. So there's three ligaments. There's the ATFL, the CFL, and the
I
PTFL.
thought you were going to say NFL.
That's right. We'll put a little diagram, shows where these ligaments are.
Right.
Yeah.
So most commonly injured ligament in the body, right? Oftentimes an inversion injury that happens.
Right. So inversion, so when you roll your ankle and your foot kind of goes towards the middle.
Yeah, right. So it stresses those ligaments, tears it, and what happens then is it's kind of a mixture of two things. So one, when you tear it, you also tear some of the nerve fibers that help you balance,
Okay.
right? But then you also tear this ligament, right? So whenever you're on uneven ground and the ankle rolls, a normal ligament would kick in, stop it, act as a check rein,
Right.
and stop it from rolling. Also, before you damage your nerves, the nerves will supply the body with the information to stop it from rolling in the first place, right? So once you lose those two mechanisms, any little step or uneven ground or even any sudden change in direction, such as pivoting sports, you're going to roll your ankle.
Okay, so you're like a 16-year-old boy, you're playing volleyball, you jump up to block at the net, you land on someone's foot, which is a classic mechanism,
yeah.
Or you're a basketball player and you just kind of roll over one way. You got pain, you got swelling, you got difficulty weight bearing, so you're going to maybe your family doctor, maybe a walk-in
Yep.
clinic. How does the process start? Or like, what do you see? What do you find on examination? And what tests do you do to confirm the diagnosis?
Yeah, so, you start with your history. That's
Right.
very much the mechanism. That's like 90% of the times,
Okay.
what you see, some form of inversion injury. They're often going to be complaining of pain on the outside of your ankle.
Right.
And so, it's a bit of a, you want to rule out a fracture. So what you're going to do is you're going to like palpate around there. A lot of times, everything's so close together,
Yeah, it's
right?
all
So
sore.
it's all sore, right? So you're like, something hurts. So then, you get your X-ray. X-ray is oftentimes normal.
Yeah.
Sometimes you get like a little, what we call avulsion, where a tiny little bit of bone where the ligaments attached to the bone pulls off, right? But for the most part, you're going to treat these conservatively with a boot to let the inflammation settle, and then you kind of see them back in about 6 weeks' time once you're sure there's no fracture,
Yeah.
and then you're going to re-examine them to assess for instability. So the big test.
Just for our patients with the
Yeah.
X-ray, some of our patients say, "Well, you told me that you can't see it on the X-ray. Shouldn't I get an ultrasound and MRI right away?"
No.
Okay.
Right. One, I don't think ultrasounds are particularly
Not the best test.
Exactly right. It's all very user dependent, and the MRIs in the initial periods aren't going to show too much because everything's going to light up, right? Because there's so much injury there, right? I think a physical exam, kind of at the 6 to 8 week mark, is a little bit more reliable. So we do this thing called the anterior jaw test, where we basically, we stabilize the tibia, we kind of shuck the ankle back and forth, compare it to the other side.
Yep.
Right? If your lateral ligament complex has been disrupted, you're going to have a lot more shuck.
Right.
Right? And then the first step, once you determine that you've got lateral ligament instability, is physiotherapy.
Okay.
Right? Something like 80% of people that do the physiotherapy will get better.
Okay.
Right? Physiotherapy, and patients will ask, does that make the ligament heal? It doesn't make the ligament heal, but what it does is it trains your muscles, trains your brain to be able to be much more sensitive to detect uneven ground, to detect when the pivot's coming.
Because you can't really train your ligaments, right?
Right,
That's
no.
why patients are like, well, why is physio seems dumb?
You're right.
Right.
Yeah.
But I agree, the proprioception side, right?
It's huge, right? So the majority of people will get better with it, but there's a small portion of people that don't, and those patients usually are the ones you kind of talk about, ligament reconstructive surgery.
Okay, so go ahead.
I had a quick question then. You mentioned a boot for immobilization. Now, years ago, I used to put someone in a boot for 6 weeks. Then I read some recent articles, and they're like, no, you only want to boot for 1 to 2 weeks, and then get them moving with the physio. And then that's question A. And question B is returning to the sport that caused this thing in the first place. I used to keep them out for 6 to 8 to 12 weeks. And then I read some articles that said, no, you want to try and get them back with a brace as quickly as possible, 2 weeks if their pain permits and their strength is good and their range of motion is good. Where do you sit on that stuff? On A, how long do you mobilize for, and when do you get them back to your sport?
Yeah, so for patients that are like super active, they really want to get back. So like the people that want to get into competitive dance or the varsity athletes, I will put them in for 2 weeks.
Okay, a boot for 2 weeks.
Yeah, because you want that inflammatory phase to settle, right? Because if you keep irritating it during that inflammatory phase, it's going to stay painful for longer, right?
Okay.
And then I will kind of gradually. I don't recommend just going right back into the sport. I'll recommend a gradual return, so physiotherapy for the proprioceptive training, as well as sport-specific activity, right?
Okay.
Because every sport's a little bit different with how you land your leg, how you pivot, how you turn, and your brain can be trained for that.
Sure, and
right?
every severity of sprain is different too.
Exactly, right?
So ballpark, can you even give a ballpark, or is it so patient specific as to when they go back to the
Generally
sport?
patient specific, but I think for the high-end athletes, I usually like 4 weeks
Okay.
to kind of get them back to that, because you don't want to send them back early, and then they end
Injury.
up back in your clinic, right? So.
Okay, reasonable. That's kind of the jives with what I've been seeing in the recent literature.
So now you have someone that either has ongoing pain, ongoing instability, or multiple recurrent episodes. They come and say, listen, I've done this 9 times, significant episodes. What investigations do you do, and then what conversation do you have about the potential surgical treatments for something that's quite debilitating?
Yeah, so the next step would be an MRI.
Okay.
Right, so the MRI will, it'll confirm your diagnosis.
Yep.
Because sometimes what'll happen is you'll do the test, but they're so painful, there's a
Big
scarring,
guard, right?
And so it seems solid, but their history of rolling their ankle, it's convincing. So the MRI will sometimes let you know that there is that, confirm that there's a tear there.
Yeah.
The MRI will also confirm whether there's injuries to other parts of the ankle, and so oftentimes with these, when you roll your ankle, you can get these little osteochondral defects, right, where you get these tiny little microfractures that are pain generators, and so
In the joint itself.
in the joint, right, especially on the talus, and so those are ones that you want to be able to pick up,
Right.
right? So then the next conversation would be, look, you've tried physiotherapy, this is what your MRI shows. If you want to get back to sports, if you want to stop rolling your ankle, if you want to help with that pain,
Yep.
then the next step will be surgery, which would involve ankle arthroscopy, so keyhole surgery, taking a look inside the ankle, because oftentimes there's scar tissue that collects in that anterolateral gutter of that contributes to the pain, and then ligament reconstruction.
Okay.
There are people that are doing it arthroscopically.
Okay.
I think that's reasonable if you're very good at it. I usually do it open just because I want to make sure that the ligament's as tight as possible.
Right. So you're not necessarily, and so when you're fixing it, are you just sewing the ligament? Are you attacking it? Did it pull off the bone? So there's a bunch of different choices.
So almost always it pulls off with the fibula, right? Almost always pulls off the fibula. So what we do is we put a little suture anchor, right? So it's kind of similar to what those rock climbers, they hammer it in,
Nice.
it goes in easy, but it doesn't pull out. And then there's a high tensile suture, right? Fiber wire.
Yep.
Has a tensile strength of steel. And then we basically reef the tendon, stitch it back in tighter than it would normally. So
Right.
we over tighten it.
Yeah.
And so patients will be it feels stiff, which is
You're
kind
like,
of
"Good."
what you want, right? Because over the course of time, it will stretch out,
Right.
right? And so that's kind of what
Okay,
we
so if
do.
you're suffering from ankle instability and you tried all this, there is hope for you because there are some surgical interventions that can help solve it for you.
Can we talk a little bit just quickly, recovery and success rates?
Yeah.
This kind of thing?
So it's day surgery,
Okay.
right? So you come in, you go home the same day. I usually like to keep people non-weight bearing just for about 2 weeks,
All right.
right? So as long as there's nothing on the cartilage, right?
Yeah.
So if it's just isolated ligaments, I'll keep them non-weight bearing for 2 weeks in a boot, and then after that we start the physiotherapy. So The protocol generally is just range of motion for the first 4 weeks, just to keep the ankle from getting overly stiff. Then at the 6-week mark, we start putting some force through that repair, because what we find is like when you stress a repair and it heals in sort of parallel fibers, and those have a higher tensile strength.
Okay.
And then over the course of the next 6 weeks, depending on how well they do with physiotherapy, they either wean out of the boot, or when I see them back at the 3-month mark, we take them out of the boot.
Apologies to our American viewers. We've been saying physiotherapy. You guys call it physical therapy. We love you. We're sorry. We mean physical therapy when we say physiotherapy.
Yeah.
We use that interchangeably here.
Sure. So success rate and return to sport?
Really good.
Okay.
Yeah, so like it's kind of one of the more satisfying surgeries.
Like
right?
in the 70, 80, 90 kind of range?
Yeah.
Yeah.
Yeah, for sure.
Okay.
There's a small caveat to that. There are patients that have hyperflexible joints,
Right.
right? And so you tighten those out, and then they'll stretch out over time.
Right.
Very cool. That's ankle instability in a nutshell for you.
Well, and I think the people that have this, thankfully it's common but not totally common, really suffer from it. It really changes your life, prevents you from doing things that you like to do, potentially even things that you need to do, potentially your job.
I think if you're getting them back to sports, it means that you're confident that your ligaments are repaired,
Yeah.
right?
I view it mostly for prevention of re-injury.
Yeah. Now you know. If you like this video, please like it. Subscribe to our channel. Share it with someone that you know has ankle instability. You walk with them and you're like, yeah, you rolled your ankle again, bro. Watch this video.
Yeah, get up. Remember, you are in charge of your own health.
And thanks to Dr. Manju for sharing his expertise.
Thanks for having me, guys.
We
All right.
appreciate it.
We'll see you next time.